All right, guys, so in this video, I want to briefly talk about self-sabotage and how we do this to ourselves when it comes to academics. I see it in relationships, but I'll try to focus more on the academic piece of it. Uh, you know, Going through the USMLE or really any academic, quote, challenging process, it's a lot, there's a lot of work involved. And so often what I see with a lot of people who will reach out is, they're going through this, but then we talk about setting goals, and then all of a sudden the goals, I can't do this until something else happens, and they start creating this whole storyline. But when you really kind of look through it and have a deeper dive into kind of what's the mentality behind that, a lot of times we self-sabotage over fear. There's a fear of failure. Sometimes it's a fear of success, but for the most part, when it comes to this sabotage, it's that fear of failure that we have, that if we don't achieve this, or if we don't pass this exam, what are others going to think of us? It's because we've kind of put up this false sense of self that everybody sees, whereas really kind of underneath all that, there's a scared person. There's a scared person that says, if I fail this, what's going to happen to me? Am I gonna have to change careers, and then everybody knows? My parents are already telling everybody I'm a doctor, and I haven't even passed step one yet. There's a lot of pressure that's involved. I experienced that. So a lot of times we'll self-sabotage, and we'll do things to delay. If anything, it's really, I see that more than anything else. I've worked with people who are like, yeah, I can't study because I gotta, I'm going on vacation. As soon as I return from vacation, I'm gonna do this, or I gotta, can't study tonight. I'm gonna go get a massage at the spa. And in my mind, I'm thinking, like, what are we doing? Like, what's going through your mind on this? I get it in one sense if there's a fear there, but to pause, to wait, to me, there's just no sense of urgency. And I look at it like, all right, well, they're just kind of, procrastinating, which is kind of self-sabotaging yourself. You're taking yourself out of the game. You're not maximizing every opportunity that you have, as far as time, which is, time's something we don't get back. And when it comes to this USMLE, I always say, guys, you study like your life depends on it, because sometimes time is of the essence, on a lot of these matters. So, I just want to kind of review that and what are some of the steps that you can do if you're struggling with that. And a lot of people have taken, years to even sit for the USMLE. And, a lot of times there's an academic piece to that, but a lot of it too is, when they keep delaying it for these reasons that come up. I think there's an element of, some type of subconscious belief that they can't pass, and they don't want to fail, perhaps in the eyes of others, because it just brings up this sense of shame. And so really what you have to do, in my opinion, is step number one is you got to see the pattern. You have to see it within yourself to say, okay, this is what I'm doing. I know I'm not moving as quickly or like I should. I know I kind of always delay. I find reasons not to do something. And it's to really just, step number one, you got to see the pattern and own where you're at. It reminds me, this past week, I saw this, I'm a psychiatrist, if you didn't know. And so I work in a hospital setting, and, I got this consult on this patient for pseudo seizures. And you're like, as a psychiatrist, you're thinking, oh my God, pseudo seizures, where do I go with this? Everyone's saying that they can't find the seizure on the EEG per se. And this is kind of like a diagnosis of exclusion. And of course, my mindset is like, all right, well, if I put this in the chart, all the workup kind of ends on that for the most part, and that gets labeled, and then they don't get treated. And perhaps, and me being me right now, but how this applies is, pseudo seizure, if it is a pseudo seizure, there could be a psychological component, conversion disorder-esque, if you will. And so, I saw the patient and spoke to the family, and, we had our little talk and everything. And this person was in the ICU because it was a, seizure activity per se. And I was walking out and I was talking to the nurse, and the nurse is like, hey, Dr. Neal, what do you think of this? And then it's like, well, tough diagnosis, I don't want to prevent anybody from getting the, kind of the workup that they're looking for per se. And, and before I put that pseudo seizure diagnosis in there, because, they're like, well, she's had a significant trauma past and stuff, or the patient's had a significant trauma. And I'm like, well, it could make sense. A lot of times, and it's hard for us to kind of pick this apart exactly within a very short time frame to say, the event that occurred now that triggered the emotional response, really has nothing to do with what occurred now. It's what that event currently represents from a long time ago. And when I say a long time ago, I mean, if someone had trauma when they were, 5, 6, 7, 8 years of age, a perceived, a trauma, but then the current event represents that to them. And of course, then they have their emotional breakdown of someone leaving them. Perhaps they have like an illness, it kind of validates them, or having their partner worry about them, et cetera, et cetera, et cetera. But the moral out of it is, it's making that connection between the events now, which for the purpose of this video is the actual procrastination piece. What are you worried about? Was there another time when you were worried about failing in someone else's eyes? And usually there's going to be something that's kind of in the past, and and that's something to explore, because the power then becomes that when you're in that moment of like seeing yourself, okay, I should be studying, but what am I doing? I'm skimming through videos on YouTube, or for entertainment, or I'm calling a friend, or I'm going to go on vacation before I start. It's seeing that pattern, and then essentially saying, okay, I recognize that. I know where that really comes from. It comes from a false sense of fear from a long time ago, or fear from a long time ago, but it has nothing to do with the current event. So it's recognizing, number one, and then it's just identifying, well, number one is identifying the pattern, and then two is really pinpointing that and saying, again, it's like, I know why I'm reacting this way. It has nothing to do with this. It has everything to do with yesteryear. And then to tell yourself, and this is really the take-home point, is, and I can make an entire video on this piece of, it sounds kind of odd, but how you get over those low moments, even from a long time ago, when you actually explore what they are, is to say, I'm not that person anymore. I'm not that person anymore. We all have those things that we're perhaps ashamed of. Maybe there's something that we said, something that we did, something that we experienced. And the only way, when that thing drops in your head, because it will, if you actually make the connection between the two, then that true event will come to your mind, and you're like, and one of two things are going to happen. You're going to go down this dark hole. You're going to go home. You're going to lay in bed. You're not going to study. But if you can immediately, at that moment, and this is probably the best thing of this video as far as I'm concerned to tell you, is to immediately tell yourself, I'm not that person anymore. I'm not that person anymore. Because you're not. Having had that experience, you would never let yourself probably get to that same situation again. And because of that, you're better than you were. And it's being in that situation, having that mindset to know that I can move forward, I'm better, and I don't have to keep reliving and replaying that old story, because that's all this is, guys. There's just some old story that we've been telling ourselves for years and years and years, and then it carries over and affects us in the real time, and affects us in relationships, affects us in the academics. We become the world's greatest procrastinator, delay everything, point the finger at everything else but ourselves. And then it just affects us. It affects us from an academic, affects us from an academic perspective. And that's ultimately the reason you're watching this YouTube channel, is to be better. We do the videos when it comes to the academics, but there's this mental piece. There's this emotional piece that you got to overcome, because we all have it. And I hate to see people waste time. And then, of course, like I always say, when that occurs, break the goal down. This might be number 3 or 4, wherever we're at on this, but the last piece of this is break the goal down. If someone were to say, hey, Dr. Neal, I'm gonna, you're gonna, 10 years ago, whatever, you're gonna go to medical school and you're gonna do this. I'd be like, man, I had that story in my head, like, yeah, right. I don't know if I can do that. I'm not smart enough, or, all that old story. I had to hit kind of rock bottom and build myself back up. Because I got to tell you guys where I started on this. And here's a little, if you're still watching this video at this, whatever mark we're on the video, here's where I started. Okay. I asked my friend, first of all, I went to the worst school there is. If there's a list of worst schools, my school didn't even make the list, So academic wise, it was poor. You had to learn by yourself. So long story short, I was studying with this person that I had met, Sabina. Thank you, Sabina. And, I remember we were studying and I said, Sabina, I don't get it. I don't understand. What's a receptor? And, she paused. I mean, she was very kind. She didn't just say, holy, like what? Like, you don't even know what a receptor is? And we're studying for step 1. Yes. I mean, that's where I was at, guys. I mean, it was just, so that's why I had that mentality. Anybody can pass this USMLE. I could take a regular person off the street who's got a desire, and I can make you pass the USMLE. It's just a matter of a couple of, skill sets of taking an exam, and then someone is teaching you these concepts. But I started from where's a receptor? That should have been the title of my video of from, where's a receptor to chief resident, because that's really what it was. But anyways, back to this. Break the goal down. Make it achievable. Don't think I got to win the entire war at one time. I break these things down to, I'm going to do 5 questions. So when you're having those difficult moments of procrastination or self-defeat, break that goal down, set a small goal and achieve it. And, like I said before, don't let the past beat you twice. You're not that person anymore. You're stronger for having went through it. You didn't choose to go through it, most likely, but you're stronger coming out the other side. So that's my 2 cents, guys. Identify where you're at, own it. Okay. Understand that the current situation really stems from something in the past. Get rid of the old story. You're stronger for having went through it. And break that goal down. But as always, I'll end the video with, guys, make sure you help the next guy in line. It's a key, okay? Everybody's story is unique, and you have a great story to tell. So all these struggles, and I tell people this too, and when you're at your lowest moment, own it. Feel every emotion of that low moment, because it'll make your story so much greater when you tell it to the next guy and you help the next guy in line. So anyways, guys, hope you liked the video, and I'll see you soon.